the extreme uses we have and really nice results we get with minimally invasive surgery is when people have ulcers. So diabetics that have ulcers, you can do a lot of minimally invasive techniques to help cure those ulcers long term. Here's a patient, we've battled ulcers with him on his right foot. We got those done. On his left foot here recently, he got an ulcer on the third metatarsal. And we tried everything we could to offer to get it to go away. And he developed some bone infection, which he still has in his foot. But what we did, we went behind the bone infection, see, this is only 1 week after the surgery. Did a minimally invasive surgery, so we're not disrupting anything. And basically did a percutaneous metatarsal osteotomy of his, I think that was the third metatarsal, and raise that up. We'll show you the x-rays and stuff too as we progress here. But the amazing thing here, he's had this ulcer. How long has this ulcer been present? It's been present a while, hasn't it?
It's been maybe about a month.
About a month. Been here about a month. And it got really bad here, about 2 weeks ago.
It got infected.
She got infected and it has cellulitis up to here, which we were able to control with Xylox. So it took the infected cellulitis out. But we still have bone infection here, so he's still on antibiotic in my mouth. But this is a lot of healing in just 1 week. So this is 1 week post-op. We'll show you what it looked like pre-op. Got a picture of that too. And we'll follow him out for a while and give you an idea of what happens with these long-term, because that's important. Okay, we'll show you a patient that had a limb-threatening ulcer. Matter of fact, he got a lot of infection in it, and it really got a lot of cellulitis in his leg. What we did with him, we performed a minimally invasive surgery on top. You can still see a little bit of remnant of that, where we just raised this metatarsal because the third bone was down. This is very common in diabetic patients. They have plantar ulcers. We can do this without fixation because what happens is it kind of balances off the foot, and there are patients that have these metatarsals that are contracted down. Most of these ulcers are caused by pressure. They're limb-threatening. Matter of fact, he got pretty infected with this, and they're easy to crack. We're only, I think we're at 8 weeks now, and he's pretty much healed here. And it was a really bad infection. We'll show you some of the pre-op stuff. And we did this under local anesthetic in the office. So we're able to treat patients with this and very effectively without going into a lot of expense for patients and treatments that are effective long term. Matter of fact, he had similar issues with his right foot years ago. How many years has it been now?
It's been over a year now.
Over a year.
Back in January of last year.
Okay. And then the first ulcer you had with your right foot was, how many years ago was that?
Well, the first one though was maybe back in 2015.
2015. Let's look at your right foot.
It was
It was under this bone.
the first one though was right here. Cause you see right here.
Yeah, that's right.
You made it.
First ulcer you had was underneath the big toe, a very significant ulcer. We fixed it, and then that was about what? How many years? About 8 years, 6 or 7 years.
About 5 or 6 years.
5 or 6 years ago. So that's holding good.
Yeah.
And his right foot, he had some problems too. With his right foot, he had diabetic ulcers as well, and we cleared those up too.
Yeah.
And those were, where were those? They were here. He had an ulcer here.
Yeah.
And what we did with that, we kind of raised this bone up, and he had an ulcer here. Got that done. We did a little release of that to pull the toe up.
Yeah.
So we got rid of chronic ulcers on him. This is now about, what, 4 or 5 years?
This one right here, though, it was January of last year. But
Okay.
It took 4 months to heal his bone to heal up.
I got you. So we raised his bone up and got an ulcer out of that. So we got him kind of ulcer free now. And minimally invasive surgery works good for ulcers, and it works really, really well, even with people who've had other treatments to try to clear the ulcers. All the treatments work, but minimally invasive surgery is extremely good for forefoot ulcers, especially our diabetics who have ulcers that are limb-threatening, and it's easy to do. It can be done under local anesthetic without even putting them to sleep. So we did his All
Yeah.
these surgeries have all been in the office, right?
Yeah.
So we did all these in the office, no putting to sleep or anything like that.